There is much right now that is unknown about the coronavirus, but there's much that we do know right now in Kansas City. One of those things that we do know is that we are prepared, and we are preparing every day, working across departments in our city, but also making sure we're working with state and federal agencies in connection with this.
This is not our first time to the dance. As mentioned, we've been doing this for over 21 years. Our health department, or myself, or both, have served on all types of national committees to develop preparedness. Think about pandemics as categories just like hurricanes. It can be category 1 through category 5. And hurricanes sometimes change before they hit the coast. So we will adjust, we will change, we will not overreact, we will not underreact. And people need to understand we do not have any confirmed cases in Kansas City right now, but it will be inevitable that we will. And so we're working with all of our other cities across the U.S.
So do we know how many kits we have, or?
So we've had a challenge in the U.S. With the lab testing process and some contamination. And so that has been corrected to my knowledge, and more labs will be coming online, including some commercial labs that will also be available beyond the state labs and centers of disease control. In a sense, because there's no specific treatment for this different than influenza, you could actually make the argument that for the individual, other than curiosity of knowing what you have, it doesn't really change the outcome. And once we start seeing lots of cases in Kansas City, I want to remind you that 4 out of 5 folks will be able to heal easily at home. They shouldn't even have to call their doctor because they'll heal without that. We don't have to overburden the system from that. The challenge is for those that are getting iller, and then they'll be coming in regardless of whether they think they have corona or not, and we'll be giving the same types of treatment to an individual whether they have influenza or coronavirus. There's no specific treatment for this right now. It helps us from a public health standpoint in the early stages to do the contact tracing to try to figure out where the exposure is occurring. So yes, we want the lab capacity to improve, but it's not a main game breaker right now for us.
Except if you were contagious, you would want to know that. Not just for your own treatment, but for the safety of others.
Dr. Carney.
Yeah.
I would also add on to what Dr. Archer is saying, is that the test is not immediate either. So if there is a high concern for this exposure, we have to go forward with the proper measures without an answer, without a test anyways, because it takes time for us to get that answer back.
Do we have test kits here?
So we have the ability to draw the samples and send them in. We aren't doing community surveillance at this point.
Can you speak more specifically to what kind of steps you're taking aside from having meetings and staying in touch with federal authorities?
I'll start with that because in some ways the answer is at this point, no. We are making sure that we're as prepared as possible. So necessarily part of that is actually talking to our state and federal partners somewhat regularly.
Do we have any plans to alter the basketball tournament coming up? And we'll also have voting coming up. Are we going to take any precautions of people wearing gloves or masks or anything like that with these group outings?
No, unless for some reason the circumstances change.